Welcome to Peace of Mind for Pet Parents, the podcast by BrightHaven Caregiver Academy. I'm Gail Pope.
And I'm Karen Wiley. And together we're here to support you in navigating life with your aging or ill pets. We know how deeply you care for your beloved companions, and we're here to offer guidance, understanding, and resources for this meaningful journey.
Each episode, we'll explore topics that address the daily challenges, emotional realities, and choices you face as a pet parent, helping you and your pets find peace, comfort, and joy. Whether it's making sense of a new diagnosis, adjusting to changing needs, or simply seeking a place to feel understood, you're not alone. Thank you for being here with us.
Hello, and welcome back to Peace of Mind for Pet Parents. I'm Karen Wiley, here as always with my dear friend Gail Pope. Today's conversation is going to be a little different and a special one because we're joined by Judith Eve Rosen, who is a licensed clinical social worker and a veterinary social worker who specializes in pet loss and grief. Judith is the author of Life After Pet Loss, Daily Reflections for Working Through Grief. And so in our conversation today, we're going to explore not just grief after loss, but also what happens emotionally when you're caring for a pet through illness, through decline, and the end-of-life decisions that we often have to make. Judith has a virtual private therapy practice and has facilitated pet loss support groups at Schwartzman Animal Medical Center, so she brings both clinical training and real-world experience into her work with grieving pet parents. If you've ever wondered whether what you're feeling is normal or how to carry both love and loss at the same time, this conversation will meet you there. Judith, we're glad you're here with us.
Thank you for having me. I'm so happy to be here and looking forward to our conversation today.
We have been too. And of course, we have many questions for you, starting with your book. But there is one question I wanted to ask, just getting us started. And it's more on the personal level, because what first drew you into working with pet loss and grief?
Oh, yeah. It's a story that I actually talk about in the book as well. I had already been a social worker. I went back to school in my 40s and became a social worker. So I was doing clinical social work, working with people with substance use disorders, anxiety, depression, things like that. But we social workers have this thing that we do. Wherever we are, if we see people that are in need in some way, or we can see there's emotional dysregulation or people are upset or angry, we go, they need a social worker here. Like you're in the middle of a gas station. They need a gas station social worker, and because more and more, there's so many different areas that social workers actually work in. They have us in libraries now, for example. It's a community public place and people come in and they're homeless and we connect them to services.
Oh, how wonderful.
Right. We're always supporting humans. So I was at a hospital, a veterinary hospital. My cat at the time, Joni, was not doing well. She had CKD. I was a little upset, but I looked around when I was sitting in the lobby. I think, waiting for them to finish a procedure they were doing. There was a family over here where they were very upset because they didn't know how they were going to pay the bill. I had a couple on my other side that were making the euthanasia decision and they were crying. I could see across from me a veterinarian that was like really harried and really upset. And I said, they need a social worker here. And I thought, gee, I wonder if that's a thing. I went home that evening and I looked it up, and sure enough, there was a veterinary social work program, one of the first at the University of Tennessee in Knoxville. And I signed up right away.
Wow.
There's other aspects besides pet grief. There's animal-assisted interventions. Veterinary staff and veterinarians, they need a lot of support. It's difficult. And there's a high suicide rate among veterinarians, as you may or may not know. Then the fourth domain has to do with animal abuse and working in areas where, for example, there's animal hoarding, or looking at the link between domestic violence and animal abuse, advocating for CPS, Child Protective Services, for some connection with animal welfare. Because very often the pet can be, like they said, canary in a coal mine was the old expression, I think. They can be a signal that something is wrong. So if an animal's brought in and the vet can tell they've been abused, then there's a chance that there's abuse going on with the children in the home, for example. Unfortunately, a lot of people who are abused by their partners won't leave because the partner threatens they're going to harm the animal, or because they can't go to a shelter because the shelter won't accept animals. So we advocate for more shelters that allow pets and advocate for better laws for preventing animal abuse and so forth. So that's what veterinary social workers do. We support the human-animal bond in a variety of ways.
I am so glad, because of course that was one of the questions I was going to ask you, but the only aspect of what you were just describing, the only aspect I was really familiar with was someone is basically working within the clinic who was providing support for compassion fatigue for the staff and the vets.
Correct.
Also perhaps providing decision-making support and grief support for clients in the clinic. So my understanding was very narrow of what a veterinary social worker does. Yet, as you're describing, you're really given the big picture of all the different ways.
I mean, I don't know what the numbers are, but I think you are describing what a great majority of, at least of the cohort I graduated with, went and worked in veterinary hospitals, veterinary practices, also vet schools, because the students are under a lot of pressure and they really need a lot of support. So that's the majority. I was already working as a clinician in a federally qualified health center, which is a community health center basically here in New York. So you have to do a Keystone project, right, to get your final certification. And mine was integrating veterinary social work principles into basically primary care, into that environment. So would you like to hear what
I would. I'd love to hear.
Okay. Fascinating. Have this in mind that this was 2019. You'll understand why I said that. I looked at the different ways that I could incorporate the principles because I was doing what's called behavioral health integration, where I worked very closely with the primary care providers. If somebody came in and they had depression, they would refer them to me, for example. So we worked really hand in hand. Providers would provide medication. I would check, they would do blood tests to see if maybe they had low D or low testosterone or something else affecting their mental health. I thought, how can I bring these principles here? One of the first things I did, I looked at the research, and when a primary care provider is seeing someone for the first time, in their evaluation and in their assessment, they ask if they have a pet. That can increase rapport and engagement immediately. In fact, I don't remember the numbers, but in this research that I read, that increased the likelihood that client would come back a second, third, fourth time, because that built that rapport. Also, it's data for the primary care person to know that there's a pet in the home. So all of a sudden they come in with a rash and maybe there's an allergy or something like that. They have asthma. Okay, how do I manage my asthma? You told me you had a dog. Let's look at how we manage it and so on. That was one aspect that I did. So I did a presentation for the doctors for that. Then I came up with this wonderful idea because we did a lot of community outreach, that I would do a night for seniors where seniors could come in, and it's called Meet the Pups. They would come in and they would bring pictures of their pets, talk to each other about pets past and present to build rapport between the people. Then I would have therapy dogs come in as well and bring in people from city agencies. For example, Paws NYC, they're a wonderful organization that help people that are maybe too ill or elderly to take care of their animals by themselves, but we want to keep them together. So they come, they walk your dog, they'll feed your cat, change the litter box. So I thought it'd be great to have representatives from there, maybe shelters who foster.
Oh, what creative on your part.
Thank you.
And meeting the need, as you're talking about earlier.
Right. And as you can only imagine, I had to jump through a bunch of hoops to get permission to do this, to bring in the therapy dogs, to have all the patients interacting with them. Everything got approved, and then it was 2020.
Oh no! Now I understand why the date was so important, because I think it was March 12th, 2020, and the world changed.
Exactly. So I was able to educate the primary care providers so that they would start asking and be more aware of how important animals were, and refer grief. I forgot that part. Refer grief patients to me, which they started to do. If somebody came in and they were like feeling down, or they were having headaches or trouble sleeping, and the clinician found out that my dog passed away 2 weeks ago, they would say, hey, we have this lady. And they would refer them to me. So I got that done, but I never got to do Meet the Pups. However, since I had made connection with the organization that had the partners that would come in with their dogs. I brought them in for the staff during the height of the pandemic because they were so stressed out. So we had therapy animals come in during 2 lunch hour periods pushed together. And people came up like in like a group of 6 at a time upstairs in the executive offices because they were still freaked out about having them around patients. The nurses and some of the doctors and lab techs and PAs and stuff would come and just sit and play with the dog for 20 minutes. They loved it. You can see the reaction right away. You can see how therapeutic it is. It's so wonderful. So we did get to do that.
At the very beginning, when you were describing it, that you were asking if someone had a pet.
Yeah.
Didn't make a note of that because it would immediately change the dynamic when you were having your initial conversation with a client. That if someone would ask me if I had a pet, I would immediately be smiling that they even asked about my pet.
Yes, 100%. That's exactly it.
Yeah. Then be ready to describe how much I cared about my pet. So what a way to break barriers and begin establishing a caring relationship with someone who can be helpful.
Yeah.
That's just wonderful.
Especially if you find out that your doctor also has a dog, for example. That can really build that rapport and that care.
Absolutely.
And it humanizes people. We don't think of them as a robot medical professional.
Exactly. So. And if they say they don't have an animal, it's kind of...
I guess it could backfire. Or I say, look, I wish I could have a dog, but my cat will not permit it. Never going to happen in this house.
No, not with a tortie, that's for sure.
No, Tortitude for days. Yes, absolutely.
You've described quite a variety of situations that you have found you can be helpful in. So what kind of situations tend to bring pet parents to someone like you?
I had delineated like the 4 basic components of veterinary social work, and I work in 2 of them. Would love to do animal assisted therapy, but like I said, she ain't allowing it. So that ain't happening. So I do pet bereavement, and people usually find me through different directories that are out there, Association for Pet Loss and Bereavement, for example, or through my website. So I do pet bereavement, I do individual therapy. Sometimes it's a couple that I work with together, but it's not couples therapy. So it's not about their relationship.
Understood.
That scares me. I don't know what animal human, that's enough of a relationship for me to understand.
Let's set some boundaries.
Exactly. And I've had a few veterinarians as patients, and that's been really good because they feel heard. They don't always find people that specialize in this field to work with.
Right.
And what they go through is very unique. It's not what you think, or I don't mean you individually. It's not what one would think, I should say. Right. You may know this, but people think the moral dilemma is mainly because they have to perform euthanasia and that the euthanasia itself is traumatic. But if you talk to most veterinarians, they will tell you that what is actually more traumatic is when they believe that this is what is best for the pet, that the pet really is suffering, but the pet parent does not want to make the decision. Either they want to keep delaying it or they want to say, no, they know what they know with their medical knowledge. So it becomes a moral injury, moral dilemma. They're not able to do what they feel is the right thing to do. And that can be really hard. That can really wear on you. So it's complicated, of course, because you're dealing with different humans that are going through different emotions. You have empathy for both. But that is one of the things that can be hard on veterinarians. I remember in training, one of the veterinarians said that he had a student that said someone came in, the pet, and said, I'd like you to euthanize my dog. The dog was like 12 years old. And he was very confused. And he said, the dog's healthy. He's got a little arthritis in his hips, but he's healthy, got another 2-3 years. And he said, no, I need the dog to be able to run because I need the dog for my running partner. And he can't run anymore because of his arthritis. And he wanted to euthanize him. Isn't that horrible?
Yes.
And so you can imagine he didn't do it because a vet wouldn't do some unnecessary medical procedure, but it was a very painful moment for him. So these are the kinds of moral things that they see and deal with every day.
I was just going to say, I used to work for a vet many moons ago, and I totally agree with that because that was always one of the most difficult things. Tough. So many difficult decisions that veterinarians have to make.
all day long. And now,
Yeah.
and now with the kind of corporatization of veterinary practices, they're under more pressure, less
Perhaps.
discretion. They're under a lot of quotas to get things done quickly and to see a certain amount of patients per day. It can be really hard. So
It
that's it. Anxiety and depression come up, suicide risk comes up. And so we VSWs are there to treat that.
I'm really appreciative that you've described that to us because, like I said, my understanding was very narrow. And I think for a lot of people it is because there's not that many of you out there.
To be honest, hopefully through podcasts like this, I can spread the word. I hope I'm not evangelizing too much.
Go for it, girl. Go for it.
I am passionate, but to be honest with you, people don't even know what social workers do. They don't understand who we are and what we do. Even I didn't. I was volunteering at Red Cross and I was helping out on the disaster response line, people calling in for help. There was always a mental health professional in the room with us. And the woman that was with us that day was a social worker. She said, "You'd really be a good social worker." And I stupidly said, "Oh, I could never take children away from their parents." Because that's what people think. That's what they see on TV. And she's, "Okay, you need to read this book." There was this wonderful book, I think it was 52 Days in the Life of a Social Worker. And it showed you like all the different types of social work, first person accounts from different social workers, all kinds. That's what got me hooked when I saw what the variety of options were that I could help.
Yeah, because out of 52 options, surely there was one or two that felt like you.
Yeah, exactly. But child welfare wasn't one of them. It's a hard job. People do that, but it's not an easy job to do.
No, I would not think it was.
We hope this first conversation with Judith has opened a door you didn't know was there. The world of veterinary social work is still finding its footing, but thanks to people like Judith, it's growing. And the more it grows, the more supported all of us become, pet parents and the people who care for our animals alike. In our next episode, we'll go deeper with Judith into something many of you are already living, grieving a pet who is still with you, anticipatory grief, what it is, how it's different from sudden loss, and how to know when the weight of it calls for more support than we can carry alone. We'll see you there.
Thank you for joining us on Peace of Mind for Pet Parents. We hope today's episode has offered you support and insight as you care for your aging or ill pets.
Remember, it's not just about the end, it's about living well at every stage of life. To continue your journey with us, explore more resources at BrightHaven Caregiver Academy's website, brightpathforpets.com, where you'll find guides, assessments, and a caring community of pet parents like you.
Until next time, may you and your pets find comfort, connection, and peace in every moment. Take care.